Managing a group of patients, you wouldn't really see questions coming in the form of first intervention and priority intervention. No. Management of one patient is where you find questions as what is the first intervention and what is the priority intervention. So we're going to be talking about management of one patient. Category of questions that comes from managing one patient that is assigned to you, and they're asking you, what's your first intervention to take care of this patient? What's your priority intervention? What is your most important intervention? How do you intervene? Yeah, so in this category, we're going to be looking at 3 key criteria we're going to be using to determine if an option is the priority intervention or the other option is the first intervention. What are the criteria we're looking at? This is what I've been able to decipher and see, okay, this actually works. This is my special discovery for prioritization of a patient in the NCLEX, and I'm giving this to you for free because I'm good. I want you all to pass on your very next attempt as a SAT point nurse. Good. So now, number one criteria you're looking at here is to differentiate both of them is what is called cause and effect. Cause and effect. You see, when you're dealing with priority intervention tackles the cause of the problem. That is why it is the most important. It's just like you have a building that has collapsed. Priority intervention will be looking at, how was the foundation of this building? What blocks were used? What kind of cement was used? What kind of rods were used? How was the foundation built? What is the architecture of this building? Priority intervention, that's how it asks questions. That's how it tackles a problem. From the foundation, what caused this building to collapse in the first place? Cause. Priority intervention, both of them go the same way. Priority intervention deals with the cause of the problem. Now let's go to first intervention. First intervention deals with the effect of the problem. Now looking at this example of a building that has collapsed. First intervention, if given an opportunity to solve the problem, do you know what first intervention would do? First intervention would be like, okay, yeah, this block here, oh, it fell off. Oh, can I pick this block up and just put it right back at the spot where it fell off from? And here, it looks beautiful from the outside. Oh, yeah, we solved the problem. Huh. Can we get the blocks back up? Can we build more blocks and just mount it back on? And it looks beautiful again from the outside. People can see a big, beautiful, magnificent building again. And not really even talking about, oh yeah, what actually caused it to collapse in the first place. That is what first intervention do. It's not like it's not important. Okay, it is. I mean, you want to see a beautiful, magnificent building from the outside looking all good. But that building can collapse again. It can happen again. The cause of that problem has not been dealt with. A part of the problem was dealt with, which is how it looks from the outside. But that can happen again. That hasn't dealt with the cause. So using this collapsed building as an example here, priority intervention will be dealing with what caused this building to collapse. What is the foundation of this building? How can we get back there and rebuild it? That is the priority intervention, talking as a boss. Then your first intervention is coming in as, okay, yeah, I know this building is falling. I just want to get this building back up. I just want to mount the blocks again and build this place to look beautiful again. It's going to look beautiful. People are going to see it and love it, but no, it has not dealt with the problem, and there's a very huge chance it happens again. You see that? With priority intervention, that disease condition, attacking the cause of the problem, there's a very big chance it doesn't come again. First intervention attacks the effect of that problem, but it hasn't fixed that disease condition itself. And when we're talking about the cause of the problem and the effect is more like effect is more like, what is the signs and symptoms of this patient? What is this patient presenting with? This patient is here with shortness of breath. This patient is here with tachycardia. This patient is here with a fever. These are the signs and symptoms I have from this patient. First intervention is going to go forward. Do you know how first intervention would do this? First intervention would be more like, hey, okay, let's give an antipyretic for the fever. That's going to solve the problem. Let's just give a Tylenol. Let's just give paracetamol. That's what we call it in Nigeria. Let's just give acetaminophen. Let's just take care of the fever. Let's just give an antipyretic so this patient's fever can go down. It's not asking, why is this patient having a fever in the first place? That's the approach of the first intervention. It's just dealing with the effects. It's just dealing with what the signs and symptoms are that this patient is presenting with. A patient comes in with shortness of breath. 2 liters of oxygen tackles the signs and the symptoms this patient is presenting with. Patient is, here with tachycardia. Oh yeah, the heart rate is 150. Oh, give the patient a beta blocker. It's going to get the heart rate down. Question is, what is causing this patient to have a heart rate of that number? First intervention don't care about that. First intervention just cares about the effect, the signs and symptoms, the effect of the problem, tackling the effect of the problem, tackling the signs and symptoms of the disease condition. You get it? You feel me? I bet y'all are saying yes right now. All right. Priority intervention, on the other hand, would, step forward to this patient and ask, oh, this patient's got a fever. What is causing this patient to have a fever? Keyword here, cause. What is causing this patient to have the fever? I think we should do a blood culture. I think we should do a urine culture to see if there's a UTI going on. Let's do some lab work. Let's do some extensive lab work. Let's do what's the white count of this patient? All this is trying to check what the cause of that fever is. It's tackling the root of the problem. The root cause of the problem. That's what the priority intervention goes for. And that's all that matters to priority intervention. That's why it's the most important. It tackles the cause. The reason why this patient is having a sign and symptom the first intervention only cares about. A patient presents with tachycardia. Priority intervention is going to step forward to the patient and look at the patient. It's going to be like, a heart rate of 150? What is this patient's heart reading? Is this patient an AFib? And having a rapid ventricular response right now? Oh, that is the cause of the heart rate increase to that level. Oh, okay, what do we have to do? Do we have to do a cardioversion for this patient? Do we have to do an ablation on this patient? That is the priority intervention attacking the cause of the tachycardia. The patient is short of breath. Priority intervention is going to step forward and ask questions like, oh, okay, what's the respiratory history of this patient? Is this patient a COPD patient? Is this patient asthmatic? Can we do a respiratory panel? What's causing this patient to be short of breath? It's attacking the cause of the problem. It's not about just going, it's not after just putting the patient on oxygen. It's after, okay, this patient is wheezing right now. This patient is obviously got an inflamed airway. I want to give steroids to help with that inflammation so there can be easy passage of air to the lungs. Patient needs to be in the bronchodilator. I have to put this patient on albuterol. I have to give this patient a breathing treatment. And that is attacking the cause of the problem. And this is one way to go about it, Cause and effect. Cause and effect. Thank you for listening. I am Ajao Sandra. We have come to the end of today's episode. Make sure to hit that like button, subscribe to this channel, and also leave a comment if you've learned something good and new for your NCLEX on prioritization.